We're back, ladies and gentlemen. We're back with Dr. Gulani. I have been mentioning him because he's been dressing me beautifully. And the idea is once I'm done with these suits, they go to the USO to help veterans have something when they come out that they look good when they go for that interview. And I think that's a wonderful, wonderful gesture. That is called love for your fellow man. Yes. Dr. Gulani, what's up with the fashion? Why you love to look so good? What?
Yeah. Well, fashion is my second passion, as you know. My first passion is still making people see, and that's my drive. But it's amazing. As you ask me that question, I keep realizing fashion is what makes me a fastidious eye surgeon. I'm very, 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 very tough on myself that every eye should sparkle white, see beyond 20/20, and that's my goal.
Okay. Now, you're originally from where?
Originally from India.
Where in India?
Bombay.
Bombay, yeah, one of the big cities in India. You hear it a lot in the news. Are they a financial hub?
Yes, they are.
Yes. And so now you're growing up in India, and you look then, and then you look at your life now. This journey is huge, and so you become a surgeon for eyes. How did that happen in your life that you started moving towards that? What was the event or the thing that made you want to go that direction?
So I believe all of us have a GPS.
Okay.
You know, we should let it unwind.
Okay.
And if we did that, nobody would be mediocre. I truly believe. All of us are made different, unique, but each of us has tremendous potential. So I've followed my GPS all my life. I've never had a mentor. So as a young resident, which is the lowest rung of the medical fraternity, in India, I wrote a textbook, one of the first in the world, on color Doppler for eye tumors, and was invited to the USA. And for getting an invitation to US, and that time there wasn't email, okay? It used to be paper, mail. I used to smell it 10 times a day. I'm like, is this real? And I was invited here, and then what was amazing is the recognition at the age of 25 as an eye surgeon. In Philadelphia, they gave me the Career Achievement Award, and I was really still pinching myself, am I supposed to be here? Everybody else was...
But you had come across this idea of using ultrasound and also using what they see for the flow of the heart to be able in an eye to identify what was a tumor.
Correct.
And out of that, a doctor would know exactly what's in that eye and how to proceed to treat it, which was something very revolutionary at the time. Right. And you were bringing patients at night up to the hospital, and I mean, your story is amazing how innovative you were, this idea. And you were out in the GYN or something using their equipment to see if you could do that. Is very so. Then comes you write this textbook about this.
Right.
It becomes world famous. Everyone wants to contact you, but you're in India and you're a resident, so you really can't go to the invitations.
Really.
So what happens then when everyone's saying we want to talk to you and you can't go?
So that's, again, in my own journey, I can always say this, when you are so involved in something that's happening in the cosmos, literally the universe conspires to make you successful. So again, with no direction, it just would happen to me. I would get these letters from all over the world, and I'm just a junior resident, and I've written a textbook, and I get letters from Harvard. I'm getting letters from Royal College in London, and I'm like, is this still me? So I was in disbelief for such a long time. Could it be me? Is it a mistake?
Right.
And then I realized my love when I came here on invitation, and I wouldn't name it, the topmost universities in the US, and I constantly realized my real passion was making people see without glasses. So at that time, this was buccaneer thinking. It was like too cowboyish a thought. Glasses are normal, people said.
Right.
And I'm like, no, it's a crutch.
Yes.
So they were like, no, eye surgery is for diseases. I'm like, no, seeing without glasses is a birthright. Right. So with that passion in 1994, it was very, very, very ahead of time, if you may. And then I just dedicated my life to it. And today it's an actual super specialty that LASIK is accepted. Invented LASIK instruments, kept on pioneering vision surgery, and I guess that's the journey.
Well, there was a story you told me where you went to Harvard and they kind of told you to stay, and you said, "Nah, this is not what I really want to do. I have another plan," you know? And they were like, "What?" You know? And so you went on your own journey, you know, and you kept asking yourself, "Man, you know, Harvard asked me to stay. I mean, should I have stayed or should I go on my journey?" And now you realize you made the right decision. So what have you learned about the eye? What is it that we don't know about the human eye?
We know very little. My quest is, first of all, I was born with 20/10 vision, which is 2 lines better than 20/20. Hence, from the day I've started inventing LASIK instruments, and by the time surgeons in the US even started doing it, I was 6 years ahead of that. And I kept on pushing that 20/20 is not enough. At that time, remember, 20/40 was supposed to be the holy grail. Driving vision in Florida, for example. That's for 20/40. And I was like, no. So we pushed. And even today, I smile when every patient of mine crosses the 2015, 2020 line, because, again, that's not something like a guarantee, right? Everybody should have the potential. But what I want eye surgeons to do, what I teach them all over the world is at least try. You cannot just try for 2020, and go home going, I did a great job. No, you did not. Why didn't you push? Which patient will not let you take them beyond 2020? So it's a currency that cannot be measured.
Right. So now you have what they call the Gulani Vision Institute up in Jacksonville. Why did you come to Jacksonville?
I ran out of gas. So I get this question every day. Again, I'm blessed. Patients come from all over the world to see me. Even today, we had patients from, I think, 7 countries, 4 states. What's important is, again, destiny. I was finishing my residency in New York, and I got a call. It's funny, from a doctor who had heard me in Italy.
Okay.
Contacted a doctor who was in Florida, who was starting his department, and looking for someone who could really bring the department up. And my wife is with me. She is now become numb to all these things I do. Is 1 month left for my residency to finish. I have no idea where I'm going. People plan a year before.
Yes.
But I just knew I wanted to go somewhere as head of department and do something. So that's when I got the call, and they said, we want you to do something and bring this up. And that's when I moved to Jacksonville. Didn't know it existed.
Right.
And I would say this with extreme pride today, completing 20th year in Jacksonville, Northeast Florida.
Wow.
That, absolutely. So 2001 I came here. Now coming up, I would say this is perhaps Jacksonville, St. Augustine, perhaps one of the biggest gems undiscovered in our entire country.
Well, the Mayo Clinic is here.
More than that, the people are amazing. The weather is fantastic, sans the snow.
Right.
And I think we can do so much more. I've said this on stage many times. We could be the medical hub for the world. We are the golf destination.
Yeah, but they call medical tourism.
Yeah, let's not talk about football here, but so all those things. If you think about it, I believe Jacksonville is and St. Augustine, it's a tremendous pride we should have for what we have here. Look at the beauty, look at the weather. And my staff always laughs at me. They say you should be the mayor of St. Augustine, because every patient who flies to me, I tell them, okay, surgery is tomorrow, go to St. Augustine. It's a beautiful town, and I keep saying that. So my staff now just automatically says it to patients. It's like, okay, your surgery is tomorrow, you'll be in bed, but today Dr. Gulani will tell you to go to St. Augustine.
And so when people when people come to your Vision Institute, what are some of the procedures you do for them?
So the biggest thing I teach, and do is custom design. That's why I told you my fashion may have led me to eye surgery. So LASIK surgery, which is so famous that I'm sure every surgeon or every patient, every person knows today, it's important to realize that most doctors do only 1 or 2 kinds of LASIK. There are 23 kinds I do. There are 18 ways of doing cataract. There are 30 lens implant choices.
Wow.
There are 48 techniques to make everybody see without glasses. If you had a bad outcome of LASIK or cataract or inadequate outcome, you can be corrected back to 20/20. So that has become my passion. It always was.
Right.
In other words, these patients who are flying to me are 3 kinds of patients. One who wants just the best, for their outcomes.
Right.
Second are those who had a bad outcome of, let's say, LASIK cataract
Right.
surgery.
Right.
And 3 are those who are told they're not a candidate.
Right.
For whatever reason. There's no such thing.
Well, you had a patient that I met who they botched them like 14 times or something like that, and you went and brought him back to 2020. I got to meet this man out in Jacksonville.
During our suit giveaway, yes.
Yes, and we toured your institute, state of the art, very impressive, and there were other people there, even a friend of mine, Suzanne Shunka, who
The artist.
Yes, the artist, how you corrected a stigmatism she had that was really hampering, and now she's, you know, and she's back to painting and doing what she loves. So you've really changed the lives of many, many people. I mean, I can't understand how blind people can be happy. You know, I mean, I meet blind people and they great conversation, they look normal, but I say, how do you carry yourself in a world you cannot see? Which is so, I mean, I find that, I think I could go deaf, I maybe cannot speak, but wow, my eyes are just so important, so that you can actually take someone who's deteriorating and giving them like a boxer, a second wind to finish the fight.
Well,
amazing.
Jorge, here's where you take this conversation next level. That's the 3 kinds, yes, of patients, but more important, I believe, and I'm doing this, 20/20 patients can be improved.
Oh, wow.
I said this 14 years ago, actually, at a world conference in Germany. I said this as an anecdote at that time. I said, there will come a time very soon, in a decade, where a person with 20/20 will walk into a doctor's office and the doctor will go, maybe I can help you.
Yeah. Well, you know, someone was talking about people a long time ago, you know, when people were hunters and stuff, how accurate their eyes had to be because they had to survive. They had to be able, very far away, see where these animals were moving and movement, because that's how they would eat, they would hunt, they had fire. And I see so many people, in Japan, I was shocked. Everybody had glasses. It was like,
genetic.
Every bus I'd look, it's like, it looked like some strange movie of a planet of people all wearing glasses, you know. And I was wondering why, you know, and you see they never look far. They're always, always. And yeah, I always felt your eye is like any other muscle. You got to use it, or if you only move your arm to here, this would be very painful if you tried. So what do you see in the future for yourself? Here you have this wonderful institute, very successful. I think you just flew in from New York. You're always around teaching and helping surgeons. What's the future for Gulani?
So just recently, actually, we started the world's first cataract suite, which is no more do you have to go to a hospital for surgery and you know, be knocked down on a gurney bag and stuff like that. It's a beautiful spa-like experience. And anybody who's going to cross 58 years of age is going to have a cataract. It's like a graying of our hair. It's not a disease.
I already have one starting in one eye.
Right. Everybody will. In fact, 48 to 58 is what I call dysfunctional lens syndrome. And people have trouble in a restaurant and, you know, nighttime they're not that confident. And doctors keep telling you, wait, it's early, it's small. And there's no such thing. Your vision is impacted, it needs to be corrected. In fact, I want patients to go up to their doctors at the age of 60 and go, hey doc, can you design my vision now for the rest of my life? And that should be an ask. It's a birthright. So if you look at it that way, you won't go home morose with, hey, I was told I have a cataract, oh my God. You go, no, I'm 60. Can we please do something? And I want to see all these distances, doctor. And did I tell you I don't like glasses? So that future we have already created. We have created a cataract suite where a patient walks in, like tomorrow, all day, patients that have landed today, we are doing, they go in, they come out, and they're seeing, and they're free. Because vision is one of the most important, actually the most important sense we have. And why not enhance it?
Right, right.
Which NFL team will win? We're talking football again. If you have better than 20/20, which pilot will fly better? The one with better than 20/20.
Yes.
So it's a no-brainer.
I hope so. I should ask that question when I get on the plane. That guy 20/20.
No,
Yeah.
don't ask questions on a plane. You'll be taken away. Just eat the pretzel, say thank you, and stay there.
See, I need the donut. That's what I need, the symbol. Well, doctor, it was a pleasure. And for those who want to know more, there's you just Google Dr. Gulani and you'll be flooded with information. You're world famous, and I'm really, really honored that you said yes when I said, would you come on to my show?
My pleasure, Jorge. Let me say this also to the audience. I rarely get a chance to meet with everybody here where I live, and what an honor it's been to meet all of you. Absolutely an honor.
All right.
Thank you.
Thank you. We'll go to intermission, and we'll come back shortly.